Hi, my name is Mary. I'm one of the diabetes educators at the Naomi Berry Diabetes Center. We welcome you to our lecture series that was created in collaboration with the Berrie Foundation and Columbia University Emergency Medicine Simulation Division. A continuous glucose monitor, or CGM for short, is a small device that is used to monitor a person's blood glucose every few minutes with minimal to no finger sticks. CGMs work by using a small catheter that is inserted just under the skin in interstitial fluid. This catheter is attached to a transmitter, which sends blood glucose readings either to the user's smartphone or dedicated receiving device. They utilize Bluetooth technology, therefore, the patient needs to keep their device nearby for it to continue working. One important thing to note is that a glucose reading from a CGM will have about a 5 to 15-minute delay when compared to blood glucose reading done via finger stick. This is the average time it takes from glucose in the blood to reach the interstitial fluid. When directly compared to a finger stick, the two readings should be comparable. You may note a larger discrepancy if the person's blood glucose is changing rapidly. However, if the accuracy of a CGM is questionable or during an acute episode, it is recommended to check a glucose via finger stick blood test. Each device will give a new blood glucose reading every 1 to 5 minutes. It will also display an arrow which indicates what direction the blood sugar is heading. For example, when an arrow is pointing to the right, it means that the patient's blood glucose is not expected to change much. When there are two arrows pointing up, it indicates that their blood glucose is rising very quickly. Next are some of the most common types of CGMs that our patients use. You will be able to see all of these in our just-in-time training cart. First, this is the Freestyle Libre 2 and 3. With the Freestyle 2, the user needs to swipe their device, which is either their phone or their dedicated Libre reader, near the CGM on their body for a new blood glucose reading. The Freestyle Libre 3 is the smallest CGM available and does not need to be scanned for a new reading. This is the Dexcom G6 and G7. Dexcom G6 tends to be the most popular amongst people with type 1 diabetes because it is currently the only CGM that is compatible with insulin pumps. The G7 is newly launched. It is smaller but does not yet link with any insulin pumps. This is the Guardian 3 and 4. This sensor is made by Medtronic, so they are only used if the patient is also using a Medtronic insulin pump. Sensor glucose readings from this CGM will be found on the patient's insulin pump. This is a summary of different CGMs and their characteristics. As you can see, most are compatible with smartphones and only need to be changed every 7 to 14 days. So how do they work with insulin pumps? Certain CGMs are able to link to insulin pumps. This allows an insulin pump to independently increase or decrease the amount of insulin it gives based off of sensor glucose values. If the patient's blood glucose is high, it can give more background insulin. If the patient's blood glucose is low, or if they're projected to have a hypoglycemic episode, it can decrease or even stop all insulin delivery. While these systems work in the background to keep a patient's blood glucose stable, it does not replace the patient giving themselves insulin doses for their meals or for an overtly high blood sugar. In the emergency department, you will likely encounter more and more patients with CGMs. These are some of the most commonly asked questions that we get. First, the risk of infection. The risk of infection due to a CGM is extremely low. However, if the patient displays redness or swelling concerning for cellulitis, remove the device and provide appropriate treatment. What do we do when a patient requires an imaging study? It depends what imaging study the patient needs. It is okay to leave it on if your patient is getting an ultrasound, endoscopy, or colonoscopy. If your patient is getting an X-ray, CAT scan, cardiac cath, or pacemaker placement, cover the CGM with a lead apron. The only time a CGM needs to be removed is when a patient is getting an MRI. This is not because it will act like metal, but because the CGM can malfunction. What do you do if your patient is getting admitted to the hospital? As for hospital policy, if the patient is using a CGM with an insulin pump, a diabetes consult should be called to evaluate if the patient can remain on their insulin pump. Please do not remove CGM unless the patient is undergoing an MRI or a procedure where the CGM device will interfere with it. Although CGMs are not yet approved for hospital use and the patient will need to have finger sticks done for glucose testing, the patient can continue to monitor their glucose levels via CGM on their own. One of the more commonly asked questions is about insurance and cost. Most insurance companies will cover CGMs, especially if the patient is on multiple daily doses of insulin or on a pump. More and more insurances are adding coverage. Dexcom and Freestyle Libre prescriptions can usually be sent to a local pharmacy, and patients will be able to pick up a 1 month supply at a time. Thank you for listening, and check out our next video on insulin pumps.